Hey everyone, how's it going? Dr. Luke Peterson here with the Knee Replacement Therapist. You're watching the Knee to Know Show. In this episode, we're going to talk about risk factors for the development of osteoarthritis in your knee joint. If you're someone who has already had your knee replacement surgery and may think that this might not apply to you, it's actually still really valuable and really helpful information because the same risk factors that can lead to the development of arthritis in the first place and pain in the first place are also basically the same risk factors that are going to lead to increased breakdown of your new knee replacement and possibly increase your risk of needing a revision surgery down the road. So valuable information if you're someone prior to knee replacement surgery and after knee replacement surgery. So when you break down the risk factors of developing arthritis or developing what we call joint pain, so pain in your knee joint, there's different ways that you can separate them and different categories you can use. So there's one way is biological factors versus mechanical factors. So biological factors, processes, things that are going on within your body, or we might call these systemic factors. Then you also have mechanical factors, which are the different stresses that you're putting through your joint, the weight, the pressure, things of that nature. So you can also separate it, so systemic versus local. So some of the systemic risk factors for developing arthritis, developing knee pain, joint pain, this might include your age. So obviously someone, if you're a little bit older, you're going to develop more arthritis and you're going to have more joint pain. Females tend to have more arthritis, statistically speaking. If you have a greater or a higher body weight, if you're someone who is physically inactive or sedentary, this increases your risk of developing arthritis. And then on the reverse side of that, if you're someone who is overly physically active, so someone who is, on that very extreme side where they're someone who runs marathons and runs ultra marathons and trains all year round, that person is at a higher risk of developing arthritis just because of that stress and strain that they're constantly putting their body through. And then on the other side of the spectrum, you have the person who is sedentary and physically inactive. So it's actually the ends of the spectrum where you have the greatest risk of developing that joint pain, that arthritis. And if you're someone who's in the middle, who's moderately physically active, exercises regularly, stays healthy and active, but doesn't overdo it to the extreme, then you're usually in that good spot where you have a lower risk of arthritis. So the other different factors include your genetics. So your genetics play a role in arthritis. If you look at family members, parents, grandparents, aunts, uncles, you might start to see a trend in who has arthritis, who doesn't have arthritis, and if you develop it and have some. There's also things such as your nutrition. So big one is vitamin D and calcium levels, but also all sorts of things that play a role. Do you have a diet that's high in inflammatory foods, or do you eat healthy anti-inflammatory type foods regularly? Things like if you're a smoker or if you drink alcohol excessively, that might also increase your risk. And if you have just poor bone health, maybe if you have osteopenia, osteoporosis, this can play a role as well. So then those are the systemic type of factors, and so you can also look at some of the local risk factors for developing arthritis in your knee. And some of these factors could be injury or trauma. So if you're someone who has had an injury to your knee joint, and the common example, because it's probably studied the most, is people who tear their ACLs. If you tear your ACL, and if you also have reconstruction surgery after that, or if you have any type of traumatic injury to your knee joint, that's going to increase your risk of getting arthritis down the road. And this is because of different factors, still kind of being researched actively, but basically it kind of triggers something as well as, increases that inflammation of the joint in general. That's going to lead to that development or that higher risk of development of arthritis down the road. There also can be things biomechanically, so you might have knees that aren't very well aligned. So if you have knock knees or valgus deformity, or if you have the bow-leggedness or varus deformity, we call it, that can put a lot more pressure on different aspects of the knee, and that can develop arthritis in those particular parts of the knee more. Also, along those same lines, if you have some significant abnormalities in your gait and in your walking, now this is something that you have to take with a grain of salt because everyone walks a little bit differently, right? There is kind of this normal zone of what's kind of normal walking, and everyone's going to vary a little bit one way or the other. No one has this perfectly mechanical, perfect gait or walking, but if you're someone who's really on the extremes where you have this really abnormal gait that ends up putting a lot of stress through your knee joint or different parts of your knee joint, that might increase your risk of developing joint pain. And the other one is just general muscle weakness. So having weak muscles, especially those quadricep muscles we always talk about of your thigh, but also weak hips and just weak general legs and lower extremity musculature means a lot more stress that could be used and taken through the muscles is taken more now through your knee and through your joint. Some other things we talk about is your occupation. So of course, if you're someone who works an occupation that is very physically active, puts a lot of stress on your knees, maybe you're kneeling, maybe you're bending, lifting, climbing, whatever it may be, that's going to put a lot of stress through your knees, increase your risk. If you're someone who has a leg length discrepancy, so one leg is a little bit longer than the other, again, this goes back to those mechanics of how you're walking and how you're moving, might put more stress through different parts of the knee, lead to increased risk of arthritis. And then there's also some things such as, more, might have a defect or something wrong with your cartilage. You might have a bone marrow lesion or something bad going on in that regard. But overall, those are some of the best factors and some of the main risk factors. So a lot of times when I describe risk factors of arthritis or risk factors of needing a revision knee replacement surgery, you look at the things that are going on within your body, and then you look at the things that are happening mechanically, the amount of stresses that are going through your knee joint or different parts of your knee joint. And people often say, well, what can I do with this information? How does this help me? Like, that's great, but how does that help me? Well, you want to look at modifiable versus non-modifiable risk factors. So of course there's the non-modifiable things, the things we can't change. We can't change our age. We can't change if we're male or female. We can't change our genetics. We can't change if we had an injury in the past or something like that. But there are a lot of things that we can change. So even though those things might increase your risk already, at least look at the things that are modifiable and the things you can change, and let's try to control those things as best we can. Things like your body weight, trying to maintain a good, healthy body weight for both the mechanical reasons and the systemic reasons. There's a lot of things that happen throughout your body with fat tissue and hormones and inflammation based on having that excess body weight and excess body composition, excess body fat, really affects your body both from the mechanical standpoint of putting a little more stress through your knees, but also a lot of biological things that are happening through your body as well. So that's something that you can definitely control. You can have good nutrition and eat healthy. That's something that you can control. And you can look at the other risks. Look at things like, am I working out? Do I exercise regularly? Do I do moderate intensity? Am I not overdoing it where I'm training for Ironman and training for, running tons of miles every week or whatever it may be? Am I in that comfortable moderate range? Am I not someone who's on the other range where I'm sedentary or inactive? You want to be in that middle moderate range, at least in terms of your risk for developing arthritis. And, just look at, is there anything else I can do? Can I build strength in my muscles? Can I get some physical therapy maybe? Whatever it may be. So there's all sorts of risk factors that play a part in your development of arthritis, the progression of how significant your arthritis becomes if you just have a little bit of arthritis or you have a lot of arthritis, and how much pain is accompanied with that arthritis, which we'll talk about more in some future videos. But then there's also, in the same breath, after you've had knee replacement surgery, those risks to consider, because those mechanical stresses or the biological stresses are going to increase your possible need for revision surgery down the road. So think of the things, be aware of the factors that you can't really modify, but really focus in on those risk factors that you are able to modify. And the great news is, with the things that you are able to modify, you're going to see benefits of that everywhere else. I mean, think of all the different things that are improved with your bodies if you maintain a healthy weight, if you exercise regularly and have good strength. I mean, think of all the positive things that come from that, just besides decreasing your risk of developing joint pain, developing knee pain, and arthritis. So it's a beneficial thing to do. All right, so thank you very much for watching, everyone. This has been the Need to Know Show. We're talking about risk factors for the development of osteoarthritis or any type of arthritis in the knee, and risk factors for potentially needing a revision knee replacement surgery. Thank you very much for watching. If you have any questions, let me know in the comments below, and I'll be back tomorrow with another video.